Welcome to the Seattle-King County Coalition on Homelessness's Medicare and Medicaid training with Solid Grounds Benefits Legal Assistance. So I'm happy to introduce Patty Lowe, Patricia Bowen, and April Mazur. So please take it away and share your good knowledge with us.
Thank you, Jody. So we'll be screen sharing here in just a moment. Perfect. I can see it, so I'm going to assume everybody else can as well. If you have any issues with tech at all, please feel free to put it in the chat. We will try and monitor. If you have questions, put them in as we go as well. We may not answer it as we're going, especially if you think we'll get to your answer in a slide or two. But if you want to put it in the chat, we will get to it, especially at our breaks as we go through. So as Jody said, we're here today to discuss Medicaid, Medicare as an overview. My name is Patricia or Patty Bowen. I'm the program manager for Benefits Legal Assistance at Solid Ground. I use she, her pronouns. Also co-presenting with me today is Brittany Lowe, one of our amazing benefits attorneys, and she also uses she, her pronouns. She will hop on after my few slides to do the next section. We can go to next slide. Perfect. So before we jump into the content of today's presentation, we do want to take a moment just to acknowledge that public benefits law and public benefits as a whole are steeped in a systemic racist system. It is created and off the backs of racist systems. We could have an entire conversation about this that could take all day. It's not the reason we're here today. So we do want to share some links to read up on this really important issue, but we don't want to take too much time to focus on that. But we do encourage you, please utilize the links. They'll be shared with you in the PowerPoint. In addition, we have, can you go, there we go. We have a program called Ask a Lawyer. So because you are participating in today's presentation, you have the ability to contact us at BLA if you have any questions. If you have a client, for example, who you think doesn't really need an attorney to represent them, but you want to make sure you're giving them accurate information and you just kind of have this sticking point on one particular question, please email us. You can do so by emailing us at the email on the screen. It's benefitslegalhelp@solidground.org. That will email into our program and it will be answered either by one of our attorneys or social worker, depending on the content and scope of that question. And if we think, really, this is a complicated answer and we're happy to help them instead, we'll let you know and let you know how to refer to us as well. So that is something we're happy to do as well. So into kind of the meat of it, today we'll be focusing on quite a few things. If I'm going to be honest, it's a bit of a dense presentation. Shockingly, Medicare and Medicaid is not a light topic. So on the screen, it kind of outlines what we'll be talking about. Apple Health or MAGI, classic Medicaid, medically median spend down programs, a brief overview of Medicare, Medicare savings program, benefit pitfalls, and hopefully how to avoid them. And then if you do fall into those and you have an issue, how to appeal any sort of decision. And if at the end of the day you realize, I think this needs to be looked at by an attorney, how to refer to us so that we can help you and your client. And so before we hop in, some helpful definitions, just so that you know what the heck I'm talking about if I use acronyms. The Healthcare Authority is something I will use a lot, HCA, Department of Social and Health Services, DSHS. And then the distinction between earned income and unearned income. Earned income is money from wages and employment. Unearned is basically every other source of income, including unemployment income, Social Security, all of that. And then resources are separate from income. Those are the assets set aside. So it's not money coming in each month, but it's money that you have access to. That can be cash, savings, checking accounts, bonds, stocks, mutual funds, in addition to real property. So if you own a house, for example, the amount of value you own in that house is a resource. Your vehicle is considered a resource, etc. It's not your everyday items. I don't expect you to know, like, how much is my couch worth? How much is my TV worth? But if you own valuables, those are considered to be resources as well. Perfect. So Medicaid renewals. Generally, all Washington Apple Health, also known as Medicaid, programs require a renewal of eligibility at least every 12 months. That being said, there are some exceptions, and I'll loop back to those. A reminder is sent out by DSHS at least 45 to 60 days prior to that eligibility needing to be renewed. So approximately 10 months into your cycle, you should get a reminder. That being said, it is your responsibility to follow up on that and complete that eligibility renewal. And it's important to make sure to contact DSHS with any updates at this time and also throughout. Receiving, so it's important to review information and complete the renewal. You can do that on Washington Health Plan Finder or Washington Connection client account. So if you know your login for that, you can do it online through that. Some of those exceptions to the 1 year are if you are going through the Children's Apple Health program, you don't have to complete a renewal until the child's 6th birthday. So from birth to age 6, you don't have to renew it every single year. However, upon the 6th birthday, you do need to start doing that yearly renewal. In addition, if you have a spend down program, you do need to complete the renewal in compliance with how long that spend down is. So commonly 3, 6, 9 months, you have to complete that renewal as stated on your paperwork. So it's more individualized. Other than that, it's a 12-month renewal. How to complete it, it's kind of redundant with what I already said, but here's the actual website and actual phone numbers of who to call. You're welcome to screenshot this, share it. It'll also be in the slides that we share it after this presentation. I'm not going to read through it just because I don't expect you to memorize these numbers or our websites, but it's helpful to have it all in one place. Next, perfect. So let's say you forgot you received that notice saying you need to renew and you just spaced it. You know, there's a lot going on. We get it. What happens if you miss that deadline? So if you miss it, you and your household are technically have lost coverage, but you have 90 days to complete the renewal using one of the renewal options. So it's not like a, oops, I forgot, and now I'm, up the river, no boat, don't know what to do. You do have 90 days to complete it. If you're found eligible, your coverage will continue from the date that you lost coverage with no gap, which is great. If you are not found eligible, you may qualify for coverage through a qualified health plan with or without help paying for your premium. So that's that kind of tiered system of Apple Health being one tier, qualified health plans being the next tier. So you might be eligible for that, and you can be screened for that at the same time. You must complete your renewal to see if you're qualified for one of those, however. So if you realize you missed it, apply immediately, go through that and see what you qualify for or your clients qualify for. And this is just to show Medicaid has a lot of different names. Here in this presentation, we'll be calling it Washington Apple Health and then a breakdown of like Magi or Classic Medicaid, but you might hear it referred to as many things. They're fairly interchangeable. If you have a question about the distinctions, we're happy to answer it. But for now, we'll be calling it this. And like I said, Magi and Classic. There are two types of, well, there's actually three types, but we're not going to get into the children's one. There's two types of main Medicaid programs in Washington state. One of them is the Magi, which is for adults, children, families, and those who are experiencing pregnancy. And this is based on your adjusted gross income, or your AGI. And that's found on your tax form 1040, plus or minus some types of income, which we'll get into. Classic or non-Magi is that long-term care, aged, blind, or disabled, or the ABD program. You'll honestly probably hear it called ABD more than you'll hear it called Classic or non-Magi, but again, they mean the same thing. And that is distinctly for those individuals who are experiencing blindness, a disability, or who meet the age requirement. Like I said, there is a very small subsect called the CHIP Apple Health Program, which is for children. It's a lot more rare, and we're not going to get into it today, but if you have questions about it, happy to answer those as well. So some Magi basics. Apple Health Magi is Washington's main Medicaid program, and that's because it doesn't have that age or disability requirement. It's solely based on income, and it's put in place to ensure that there is coverage for low-income Washington residents. Under the ACA, adults who do not meet other requirements, like I said, such as disability or being a minor child, can get Apple Health Care through Medicaid coverage through this Magi program. And this is children being considered over the age of 18. Perfect. So coverage for Magi, who does this cover? Again, a little redundant with what I just said, but we want to make sure it's clear. This is anyone ages 19 to 64. It ends at that age because at that point you become part of the classic Medicare program. You do have to be a US citizen or an eligible immigrant. That being said, there actually is a program in Washington now for immigrants, for qualified immigrants. It was put into place November of 2023. However, it has filled up, which is unfortunate. We do want to mention it here, though, because if you, like I, think that more availability should be put in place and more funding should be allocated for this, you can know about it, research it. It'll be included as a flyer with the presentation that's emailed out to you, so you can educate yourself about it and advocate for it if you're interested. But in terms of classic, or in terms of Magi Medicaid, you do have to be a US citizen or eligible immigrant. You do have to be a Washington state resident. Otherwise, you have to be on a different state's healthcare. And parents and caretakers are eligible as well. Household income has to be at or below 128% of the federal poverty level, which we have a lovely, confusing graph that will show you what that is. It does change yearly. So this is accurate as of right now. A year from now, we will update it and share that with you as well. Children and pregnant persons can qualify at higher income levels, and family programs are also available at higher incomes as well. So, for example, an individual person income is different from a household's, which makes sense. Let's go to that chart. Perfect. So this is the lovely chart that is hopefully digestible. If you have questions about it, please let us know. It shows the categories for each of those subsects that I was talking about. New adults, quote unquote, are just adults from the age of 19 to 64. And they are the ones at 128% of the federal poverty level. Pregnant persons have a higher federal poverty level percentage. Adults, Apple Health with children have no premium. Family programs have a higher federal poverty level as well. It shows a household income limit for one person, two people, three people. It goes beyond that as well. And you can look at those by following the link on this slide. It's just on hca.wa.gov, and it shows all of those income limits. And those are updated every July 1st. So these are pretty accurate, well, pretty newly accurate, and will be for the next, 10 months. So next slide. Perfect. So what type of income is counted for this? Like we said, any sort of real or any wages, taxable interests. So that's like if you have a savings account that gives you, a few cents, a few dollars every month, that would count. Dividends, unemployment benefits, pensions, IRA distributions, spousal support discount as well. Income from self-employment, income tax refunds, rental income. So if you're a landlord, you need to count that money that you're getting, and Social Security benefits. And this is true even if your benefits are not taxable. So that is what's counted when considering. We will go on to talk about some distinctions in the next slide. So these are the types of incomes that are not counted. Those would include veterans benefits, child support, certain scholarship incomes, Native American tribal income, and gifts or inheritance money, as long as those are clearly distinguished as such. Perfect. So the next part is, okay, I know what to count for the income. Now what? There are allowable deductions for income. So the following are some of those examples. If you are the one paying spousal support instead of receiving it, that counts as a deduction. If you have experienced housing instability, you're moving and you've paid a lot for that move, such as hiring movers, etc., you can count certain moving expenses. If you've paid student loan interest, if you're paying for your own health insurance due to self-employment or self-employment taxes, those are both deductions, and IRA deductions, and any money that's put into a flex spending account. So if you have questions about that, ask. It's always worth looking into just to make sure you're only counting the income you need to and taking full advantage of all deductions. The nice thing is, so that was all talking about income. Separate from income is the consideration of resources. Apple Health Magi does not have a resource or asset limit, which is great. Unlike some, well, most other programs where you have that cap amount of resources that you need to keep track of, Magi, you do not have to. So if you own your own home, you would still be eligible as long as your income qualifies you, for example. Go ahead, next slide. This is how to apply for Apple Health Magi. You can do it online through the Apple Health, I can't speak this morning, Washington Health Plan Finder at the link there. I was skipping in my brain to the fact that you click free or low cost Apple Health. You can do it on a mobile app, you can do it via phone, you can do it via mail or old school fax. And they do have navigators available to help you find and compare and select health coverage. I'm not going to go into detail and read all those details again because it's a lot to digest, but it will be available on those shared PowerPoint that's sent out to you. When you apply, it's important to have some information. That information is your monthly income, immigration status, if that applies to you, date of birth of everyone in your household, social security numbers of everyone in your household, and domestic violence survivors may not be required to provide this. It's important to have it available and to ask though. And I see that someone put in the chat that they are a navigator. That is amazing. Thank you for sharing that. But yes, let's go to the next slide. Perfect. How and when can I apply for and switch plans? So you can apply at any point during the year. Unlike a private health insurance program where you have that open enrollment period. For Magi, you can apply at any point. And you can switch plans as often as once a month. So you can do that by calling the healthcare authority or the HCA and going through that process. In addition, there might be some reasons why you need to update them on information, and they are listed here. You need to immediately report changes if your household income changes by over $150. You also need to let them know if you move and therefore your address changes, if you get married or you get divorced, if you become pregnant or if you lose a pregnancy, if you give birth, or if you adopt a child, if you would go into or are released from jail or prison, if you enter a nursing home, if there's changes to immigration or citizenship status, changes to healthcare coverage, changes in tax filing situations. You can report all of these on WashingtonHealthPlanFinder.org or by calling. But it is important to remember that these are required reporting. So if you have one of these changes, it's important to provide that information. Otherwise, you could be found to have accidentally or intentionally misled. And so it's important to let them know immediately, call in or go online and update. Next, okay, so some tips. Most Washington Medicaid members will be enrolled in an Apple Health Management Care Plan. And this is managed, this managed care means that you have a set doctor's network to choose from. And the plans are not all available in every area though. So, the plans that you might have available to you in Monroe, Washington versus Seattle versus Spokane, they all might look different. All Washington Medicaid plans include the same basic benefits, but some plans do offer extras. And those may convince you to join one versus the other. Examples of some extras may include you might get a free cell phone or free Boys and Girls Club health membership or GED testing, breast pumps, acupuncture treatments, rides to medical appointments, etc. So based on your own individual needs, one plan might be more or less beneficial for you. So it's important to look through the fine print and see what works best. So there are 5 main managed care organizations in Washington state. Is it true that all plans are available in King County? Yes, they're available as far as I know. Yes, King County being a major metropolitan area has the most availability. That scarcity of programs is a lot more noticeable in smaller areas throughout the state. So if you're zooming in today from outside of King County, those scarcities might apply. King County, we have everything here, good, bad, and otherwise. So in this case, it's good you have all of those options. And that was in response to something in the chat. Apologies. So in Washington state, we have 5 separate managed care plans. We have the Wellness Point Washington. It's previously called AmeriGroup, Coordinated Care of Washington, Community Health Plans of Washington, Molina Healthcare of Washington, and United Healthcare Plan of Washington. So if you hear any of those, you understand kind of what those are. So this training is mostly for those of you who are helping people along this process and may not be using it yourself. This is how you can help clients choose from the MCOs available. And one of the great things available is the Healthcare Navigator, and that's on Health Plan Finder. The link is in the slide. It helps determine the specific medical needs of each of your clients and pair them with available plans, including looking at foreseeable medical needs. Your needs as a able-bodied 20-year-old might be very different from your needs as a 6-year-old who's experiencing a healthcare crisis of one type or the other, or somebody with children is going to experience a lot of different healthcare needs than somebody without. And every single person is different, it helps to look at an entire array of options and think through your individual family's needs and pair that with what's available. It's also important to determine what resources or assistance your client could utilize to improve their wellness. Examples could include family coaching or disability advocacy. So there's options there to help in addition to just showing you what healthcare plans are available. So this is Magi that we've just gone over. I do want to take a moment to pause and see if there's questions. After this, we'll be going and looking at classic or non-Magi or ABD. So if you have questions about that, please hold off because we will be hopefully answering those. But if you have any Magi specific questions, feel free to put them in the chat now. But also if you think of them in 10 minutes, you can put them in and we will loop back. We'll answer all questions in the chat.
Thanks, Patty. I'm not seeing anything other than my question, and I apologize. I didn't mean to interrupt you. I was putting it in there so my brain didn't lose it. And I appreciate the, if questions, come to somebody as we go through, we can loop back to those. But yeah, as Patty mentioned, throw something into the chat. Feel free to just, raise your hand and then come off mute. And I just also wanted to shout out to thank you, Saf, for putting in the chat that you're a navigator. I think that navigators are embedded in many different programs that your folks might be accessing or utilizing. So it's always a good question to ask. And I know that a lot has changed, sort of through the pandemic. So that landscape may have changed, but it was a lovely reminder to know that knowledgeable folks are embedded in our programs and as our colleagues throughout the community. So thank you for that lovely reminder. Not seeing anything. I'm going to have us move on, but as Patty said, don't let us moving on stop you from finishing typing, and we'll loop back to you. So carry on.
Perfect. So we'll continue on and discuss classic Medicaid, so that non-Magi. So this is for, next slide, people 65 years or older, people who are disabled, those who are blind, and earn at or below the SSI federal payment amount, or have Medicaid spend downs, and we'll get into that. They often receive SSI. There's also a category for workers with disabilities, or HWD, which we'll get into as well. This is a categorically needy program. What that means is that a person who receives federal cash benefits under the SSI program is automatically eligible to receive this program. The same income and resource for SSI applies to this program. So if you're found eligible for one, you are automatically eligible for the other. And that includes $2,000 resource or asset limit, and the income limit currently set at $943. The program covers CN coverage, provides CN coverage to individuals who meet the SSI income and resource requirement, as well as having met one of the following. So unlike Magi, it's not just an income requirement. You also have to be found eligible by either being 65 years or older, meaning that aged part of ABD, disabled or blind. And this coverage is mostly for, like it says, ABD, aged, blind, and disabled. Categorically needy SSI, like we mentioned, here are the household income and resource limits. So for one person, it is that $943 income limit and $2,000 resource limit. For two people, it does increase, but it's not multiplied by 2. It goes up incrementally. And this changes on January 1st of each year. So this is accurate for 3 more months, and then it will update for 2025. How to apply? When a person is approved for SSI or ABD, they may be automatically enrolled, but as a precaution, we do advise that you apply as well. That's because, errors happen, and we'd rather see you do one more step that you don't need to than accidentally not get some coverage that might really be beneficial. So you can apply through SSI, through the Social Security Administration for SSI, can apply for ABD, and categorically needy through DSHS. The information again is on the screen and will be shared out. And that's all we have for this one. It is a shorter, more straightforward. It's also the classic, so it's been around longer versus Magi, which is a newer program in the long term. Please let us know if you have any questions. I'm again not seeing anything in the chat, so I will give it over to my colleague Brittany to talk about the next portion, which is our medically needy program. But again, if you think of a question, put it in the chat and we will loop back to it.
Yeah, and right before Brittany jumps in, I just want to say I did throw a link to our YouTube channel because this is where this training will be uploaded to, and in case you missed it in the chat, I will be sending these slides out to everybody just for review or sharing with your colleagues as the case may be. We also have really specific trainings on ABD and HEN, and then we have trainings as well from our benefits law center colleagues on SSI, SSDI. So if you're kind of like, oh, what are those definitions? We've got that information for you all on the YouTube channel. So thank you, Brittany, for letting me jump in.
Thank you. Good morning, everyone. I'm a benefits attorney with Solid Ground. Fortunate to work with Patty and to be able to help clients every day apply for these different programs and sometimes step in if we need to assist them with a hearing. Please reach out with the links that Patty provided if you have questions, and we'll be happy to help you. So we're talking about classic Medicaid right now. Patty already went through, there's two types of classic Medicaid programs. The most common type Patty already talked to you about, that's the categorically needy, the CN program. You can think of that as for the lowest income folks that are below $943 a month for an individual. So there's this other program that I'm going to talk about now called the medically needy program. This is also for lower income folks who are that ABD category, the age blind disabled, and they are making above that 943 amount. So this MN program provides coverage for them above that amount, and it allows them to receive it, and they have a spend down requirement for this MN, this medically needy program. You may have worked with some folks that have to meet a certain spend down, and this is the program that they're involved in. So eligibility for this MN medically needy program, again, it's a classic Medicaid program, so they're blind, aged, or disabled, and their income is too high for the regular Medicaid eligibility. So it's above that 943 level. But they have medical expenses that are significant enough that when you subtract these medical expenses from their income, it brings their income down below that amount. And so then they can become eligible for Medicaid under this medically needy program. And it does have an asset limit that matches the categorically needy program that Patty talked about of $2,000 for a single individual. So this is how the program works. You need to have medical expenses that will bring you below this monthly income standard of 943, pretty much no matter your household size. And then the resource limits do increase as the household size is larger. So if you're eligible for this medically needy program, you can get Medicaid coverage once you incur a certain amount of medical expenses during a specific period. And you've probably heard this called a spend down period. They also call this excess income. That's the amount of your countable income that is higher than the income you have set aside for non-medical expenses. And the amount of monthly excess income that you have is used to determine the spend down amount. People who have this medically needy MN program, they choose a base period to calculate their spend down amount. So they can either select 3 months or 6 months. Usually 6 months is what most people select. And then the department calculates the spend down by multiplying the number of months in the base period by the amount of monthly income. So let's say that somebody, remember that number 943, that's the current number. If somebody makes $40 in excess income above that 943, and they have a 3-month base period, then their spend down amount would be $120. So because they have $40 of excess income a month over their 3-month base period. So we multiply 40 by 3. That means that once they've shown the department that they've spent $120 in medical expenses, then their Medicaid coverage will begin. So here's an example. Sam receives $1,200 a month in Social Security disability income. When figuring this out, there's a $20 deduction for unearned income. So his countable income is $1,180. 1,200 minus 20 is 1,180. Then he gets to subtract, it should be 943, sorry, 914, I think is a previous amount for his non-medical expenses. And so he receives some excess income multiplied by 3 for the 3-month base period. And this shows how much he needs to spend down. So essentially the medically needy spend down program, the government still uses the monthly income limit of 943. They look at how much additional income you have beyond that. You need to show that you've spent that in medical expenses, and then you're eligible for coverage. So again, some things to remember about the spend down. The eligibility period is either 3 or 6 months. So if they have a 6-month eligibility period, say from January to June, they have to meet their spend down amount before June. And then Medicaid will pay the remaining balance of medical expenses through the end of June. So once they show that they've met that amount, then the coverage kicks in and covers all the remaining medical expenses. And then a new eligibility and spend down period would begin in July in this example. So a couple more things to remember. The medical bills, they don't have to have been paid by the client, just incurred. So when we're working with clients with this program, we'll help them. We'll say, have you made any medical payments? If so, we pull up the receipts to show proof of paying medical payments, but we can also use invoices or bills received from medical providers. And so sometimes we'll include a mix of both, things that they've paid as long as it's within their 3 or 6 month base period. So receipts showing what they paid, or invoices or bills showing what they owe. And for an expense to be allowed toward the spend down, it has to be prescribed by a licensed provider. So something like a supplement may not be able to be counted unless there's a prescription from a provider showing that the supplement is prescribed for that person. How to apply for this medically needy program. Remember the MN medically needy is a subset of this ABD or classic Medicaid program. This one you apply through Washington Connection. So here's the link. You can also call customer service or go in person. This is done through the DSHS offices. Once enrolled in this MN program, remember the person is going to have to be submitting medical expenses during their 3-month or their 6-month period. Okay, questions about the medically needy program?
Well, I just want to follow back up with Q, either to come off mute or throw something in the chat, but spend downs are kind of confusing. So I want to just make sure that got the question answered for you, or if there was a nuanced piece that you were maybe looking for.
Yes, and Brittany, just for you, because I know you can't view the chat, Q had a question of what is a spend down, and that was at the start of the presentation. Hopefully we've answered that.
Yeah, jump on if, yeah, she can jump on if still
I
have a question.
thumbs up from Q.
Okay.
So their question got answered. And then we've got another question. Are you technically uninsured until you pass your spend down, or is it more like a deductible?
I think it's kind of a mix between the two. I think it's something a little bit different where you're eligible for the program, but you're not going to receive any benefits from that program, which does sound a little bit more like a deductible until you meet the spend down.
Yeah, especially because if you have, some people have a really high spend down, which is unfortunate. For example, if you make, you know, 1,500 a month and you're subtracting that 943 and 20, you'd have a substantially high amount of spend down per month, and you have to meet the totality of it for that period before it takes effect. So it's not you do 1 month of your spend down and then you're eligible. It's you have to do your entire spend down for the period. So if you have a 6 month period, it's your total. Um, if you fail to meet the spend down, you just weren't found eligible for that medically needy coverage. So there's no like punishment, but you just aren't found eligible, so you don't get the benefits.
I was a little bit distracted by my cat at the door and then him smelling so lovely in my lap. So you may have addressed this, but I know you said medical bills don't need to be paid, just incurred, but did you talk about how folks need to submit those or in a time frame, or is that something that details you have to share that we need to know?
That's a good question. Thanks for asking that. I didn't really go through that. So they do have to be submitted by the person within their reporting period. So most people choose the 6 month reporting period. So then when they get their approval letter, it'll show you have to submit your bills or invoices by this date in order to have them count toward that eligibility period. And so, yes, technically the person does need to submit. Sometimes our office will help by faxing these in or mailing them in for the person. But what I found with most of the people that we work with is that their providers are really willing to help. And so we'll oftentimes see hospitals or other providers or offices, as soon as the person has the appointment, they'll send the information. You see that too, Patty, right along. And so that's really helpful.
And it's important to remember with spend downs, you don't need to pay it, it just needs to be incurred, but eventually you will have to pay it. So it's not that this benefit takes effect and then it will cover the amount that you've incurred previously. You will ultimately be responsible for paying that or getting a gift or there's other means to pay it, but ultimately it will have to be paid. It just doesn't have to be paid for the medically needy program to start.
Thank you for that. That's a important distinction, I think, and point. Okay, these were really great questions. Thank you. I'm not seeing anything else, but again, if you're processing, mulling, typing, keep on with your thought process. We'll follow back up and I will hand it back.
Okay, and next we're going to move on to Medicare. So we've already gone through Medicaid, through Washington State, and we're going to move on to Medicare, which is the federal program.
And I believe that's mine to present.
Oh, yes, thank you.
So the distinction here, like Brittany said, is, and it's very easy to mix them up because they picked two names that are so similar, Medicaid and Medicare. But Medicare is federal, Medicaid is state. So for Medicare, the distinction is you have to be 65 or older, which similar to Medicaid, ABD. You have to have worked under the Social Security or Railroad Retirement System. So that is the main distinction. Is you have to be found eligible because you have worked under it. There are certain young people with disabilities who are found eligible or who have disabled parents and are therefore eligible under their parents. but in general, the distinction is that Social Security system. People with end-stage renal disease can also be found eligible, such as permanent kidney failure requiring dialysis or transplant, sometimes called ESRD. You also do have to meet the citizenship or immigration status requirement. And unlike Medicaid, Medicare does have premium costs. So you get the coverage, but you do still have to pay some costs out of pocket. There are 4 parts of Medicare coverage. Medicare Part A, which is hospital insurance, and it covers inpatient hospital stays, cares in skilled nursing facilities, hospice care, and some home health care. Medicare Part B, which is medical insurance. This covers certain doctor services, outpatient care, medical supplies, and preventative services. Medicare Part C, which is optional medical coverage. It's Medicare Advantage and means a managed care plan. And there's Medicare Part D, which is prescription drug coverage. And this helps cover the costs of some prescription drugs. Premium costs, like I said, unlike Medicaid, which is free, Medicare does have some premium costs. Most people do not have premiums for Medicare Part A. The standard Part B premium is $174, but it can be higher depending on your individual income. Part C has a monthly premium, which varies by plan. You can compare those by clicking on the link. And Part D has a monthly premium, which also varies by plan and is higher for people who have a higher income. It's very general, but click on the links to compare those as needed. Statewide Health Insurance Benefits Advisors, or as you might call them, SHEBA. Washington State SHEBA provides free, unbiased, and confidential help with Medicare to people of all ages and backgrounds. So SHEBA volunteers are advisors, and they're located throughout the state and can help with access to assess clients' medical need coverage, to determine their general eligibility, evaluate and compare plans and programs, and provide help. You can speak with one of those SHEBA volunteers by calling 1-800-MEDICARE on your client's behalf. Make referrals to the agencies and programs, one of them being us. So Solid Ground does have a SHEBA volunteer program, and when they run into questions, like legal questions about eligibility, they frequently reach out to us as well. So this is definitely a program we encourage you to utilize if it's helpful for your clients, and we work closely with them to make sure all of this information they're giving out and advice is accurate. And if they're looking through and they think, maybe Medicaid is better for this individual instead, they reach out to us and we're happy to assist as well. Next, it just has the phone number and the website for how to contact a SHEBA volunteer and get some assistance. Can Apple Health pay for my Medicare premiums? The answer is yes, if you qualify for a Medicare savings program. So yes, asterisk. What is a Medicare savings program? It's also called an MSP. If you're on Medicare, you may qualify for help with Medicare premiums, deductions, and cost sharing. There are 4 programs that can help. They're called Medicare Savings Programs, or MSPs. They are not medical insurance programs, however. They do not provide medical coverage. They just help provide some funding to help pay for Medicare. Who is eligible? So in order to be eligible for an MSP, you have to obviously be receiving Medicare. You do have to be a Washington State resident. So even though this is a federal program, you do have to be a Washington State resident for this MSP. You have to be 65 or older. People with certain disabilities or permanent kidney failure are eligible even if they're under 65, depending on that disability. You have to be evaluated. And if you meet a standard income and resource limit. And I do see the questions in the chat, and I will loop back to them, don't worry. There are 4 MSP programs available. There's the Qualified Medicare Beneficiary, the QMB. There's the Specified Low Income Medicare Beneficiary, SLMB. Qualified Individuals, QI1, and Qualified Disabled Worker Individuals, QDWI. The one we see the most is the QMB, but they're all available and we do see all of them. Excuse me. So here's the income limits that we were talking about for those MSP programs. It is dependent on the MSP program itself. So for QMB, it has to be 110% of the federal poverty level to be, for example, versus the QDWI is 200%. So it's individualized. It's based on the chart above. There are additional breakdowns as well online, but here they are for 2024. Great news is these are increasing slowly but surely. So for example, in 2024, the QMB program, you used to have to be 100% of the poverty level or below. It's increased to 110. So that has allowed more people to be found eligible, which is great news. And other great news, for the MSP programs, the resource limit has been eliminated as of January of last year. So previously you had to spend down your resources to be under a cap amount to be eligible. As of January of last year, those resource limits do not exist. So you don't have to spend or get rid of assets to be found eligible. You can retain those assets and still have an MSP eligibility found. So here are some recurring issues with QMB and providers. Federal law forbids Medicare providers and suppliers from billing people in the QMB program for Medicare cost sharing. Medicare beneficiaries enrolled in the QMB program have no legal obligation to pay Medicare Part A or B deductibles, coinsurance, or copayments. So that means there are exemptions that your QMB might not be able to assist with. Dual eligible clients are often wrongly billed. So sometimes it might be something that is eligible for coverage, and it's just sent to the client accidentally. So they will get a bill that they shouldn't have received. It should have been covered. And it's unfortunately kind of the client's burden to show or to catch that. That's something that we're happy to help with as well, to look it over and see that bill, see the programs they're enrolled in, and let them know, yeah, that should have been covered, and help them through that process. So for example, if you have a client on QMB who is being billed and you think it might not be correct, contact us. We're happy to look it over. If it is true that it's incorrect, we're happy to help them through that process. Issues unique to QI1. So unlike QMB and SLMB, one cannot be eligible in other government-funded medical programs while on QI1. However, enrollees can be on QI1 and a medically needy SSI-related medical with spend down. I realize this is very confusing and has a lot of acronyms. Again, if you have a client who you think maybe this applies, I'm not sure, this is a lot of kind of legal and medical jargon, reach out to us. We're happy to help. Unfortunately, I don't know a way of breaking it down into a more digestible slide to give you guys, because it just is kind of a cumbersome system. But please keep that in the back of your mind. You're welcome to reach out. Once that spend down is met, they will be enrolled in a medical needy program and terminated from QI1. And again, it says, if you have somebody with questions, contact us. and you can apply for the Medicare Savings Program. Next slide. It's pretty easy. You just contact your local community services office or your CSO. You can go online, you can fill out a paper application and send that in to them. So there's a variety of ways. Hopefully one of those works well for your clients. I will take questions now. I also realize you might have a lot of questions. And a lot of times with this, it's very situational. So you might have a client who you're thinking and you have questions. This is a great time to use that Ask a Lawyer that I mentioned earlier. Send us an email. Let us know as many details as obviously you can. We can give you an individualized response instead of making our responses and details public on this recorded presentation. And then also, if we think, this is a legal issue and we're happy to help, we will let you know that via email as well and take on that client. But if you have any general questions, happy to answer them now. I do see we got one in the chat that April was able to respond to. Thank you, April. And I also love the distinction, how to remember Medicaid versus Medicare. Perfect. Please let me know if you have any other questions before we move on.
Yeah, I'm also not seeing anything, but just want to reiterate and just express my appreciation for you all and your expertise and your willingness to let folks reach out, because it is a lot of information for a training. It's very nuanced, so I'm just for anybody that's like, oh, they're probably just saying that. No, really reach out to Brittany and Patty and April and that team. They're amazing and they're wonderful. So really, really appreciate that. We got one question that just came in the chat, I think specifically about this, and then I'm going to just sort of crowdsource and get into the recording, the transportation question. So we have the question, when you have a QNB and an agency only takes Medicaid, are you eligible?
So I think you mean a QMB, a qualified medical, but correct me if I'm wrong. There's a lot of acronyms. So in this example, no, I don't think so, because specifically Medicaid and QMBs are separate. QMB is under Medicare. But if this is based on, like I said, if this is based on a real client of yours and you would like us to look it over and give you an individualized response, we're happy to do that.
Thanks, Patty. And Karina, I'm just going to pause just to see if that, we're getting a thank you from Karina. Wonderful. Okay. Good. Okay. And I'm not, like I said, seeing anybody, any other comments coming in. So if you're typing or thinking about it, I'm just going to read this transportation question that April did answer. So we got a question that says, do we have anyone here from DSHS? I have a question about DSHS Medicaid transportation benefit because HopeLink is not providing transportation for my client. And April, super appreciate you sharing a resource that is a pretty robust rideshare trip planning app for people that need it. So that's in the chat there, and we'll send these resources out to everybody. But I'm just going to see if there's anybody else on the call that might also have resources, a question directly responding to that transportation question.
Just to kind of elaborate on the findaride.org, it covers like Pierce County, King County, and Snohomish County. And there is a specific section in there on Medicaid transportation, both for King County and Snohomish County. So hopefully that is able to answer your question there. But it also links to other service providers, such as Solid Grounds Transportation is one of them, and along with many others that do kind of medical transportation in those. So just to kind of plug that there and elaborate on my comment a little bit.
Thank you, April. I'm telling you, we have I think most of the team here, and it's amazing resources to have. So super appreciate it. Okay, I'm not seeing anything else popping in, so I think we're good to move on.
Okay, so we're going to move on to talk about some benefit pitfalls and common issues. Well, we want to go through this section as well because these are some things that you can look out for, and what we see as legal practitioners, issues that come up that we want to help you look out for so that you can assist your clients with them or recommend them for legal assistance if they need it. So the first thing, this is so common, we see it a lot. Someone comes and they've been denied or terminated benefits, and it's because they haven't reported information to the department. So that's really common. One of the first things to check if you see, have you been keeping up with the reporting requirements? Also, services, procedures, and prescriptions can be denied sometimes. So you may see, you may be working with someone who received a denial for a surgery, for example, and the denial lists that it wasn't medically necessary, or that there were other options available instead of the surgery. So this is something where there's an option to appeal. And so this would be, you'd want to reach out to a legal provider to get advice on this. We see a lot of cases, the next one, child's braces, getting denied because they are not medically necessary. So there's also an option on that for appealing. We see prescriptions denied because it's been prescribed off-label or for a different purpose than what the FDA approved. Sometimes the doctor prescribing the prescription is not deemed a specialist by the healthcare authority, and they don't think that that person should have prescribed that specific medication, and they'll indicate that in the denial. Sometimes the HCA denies because a brand name instead of a generic was being prescribed. And these are all examples that you may see where there is an appeal right, and that'll be listed in the denial letter as well. So there's a time restriction for when a patient can receive medical service or and legal services can help. So let's look at the deadlines on the next slide. Oops. So I guess the deadlines are going to be just on the slide following this. But when something goes wrong, again, request a hearing. Write to DSHS or to the HCA or straight to the Office of Administrative Hearings. And for these hearings, people have a right to be represented by an attorney. A person can also, if they're speaking with the DSHS customer service, right there on the phone, they can ask for a hearing as well, or with the HCA customer service as well. Again, here's all the numbers to contact. So either any of these ways will work to request a hearing. And this is important. There's 90 days to request a hearing from the adverse action. So that would be the date of the denial. So a person receives a denial letter, the date at the top for that denial, they have 90 days from that date to request a hearing. There is a good cause exception that's kind of new for our state. So if the person has good cause, such as something serious like housing insecurity or serious medical issues, there can be an exception where they could request the hearing beyond 90 days with evidence of that good cause and likely get approved for the hearing request. There is continued coverage where people can continue receiving health coverage while they're waiting for their hearing. But to receive this continued coverage, to continue receiving the same benefits that they've been receiving while they're waiting for the hearing, they have to ask even faster for a hearing. They have to ask within 10 days, and there's not an exception for that. Here's a detail. If the 10th day falls on a weekend or a holiday, the person can wait till the next business day to ask for the fair hearing. So hearings need to be asked within 90 days generally. If they are asked within 10 days, the person can be eligible for continued benefit coverage. Again, we wanted to reference our Ask a Lawyer program. Patty talked about this at the beginning. We have this program here at Solid Ground in the Benefits Legal Help. Email address is here. Please reach out if you have any questions. We'll have an attorney on our team respond to you. We usually can respond the same day. So you can ask questions you have about a specific case or client, general question. And if it's something, it may even lead to a referral where we could take on that person as a client to help them further. So leave this information here. Here's our intake line, our general email, and we've listed Patty, our program manager, who's with us today, her name and contact information as well. Well, thank you all so much. See if there's any final questions or thoughts as we're wrapping up.
Yes, thank you. Brittany, Patty, April, really, really appreciate you being here and sharing all this information. We've got lots of time if folks want to sort of ask some really general questions. We can also, like I said, crowdsource. There's lots of really good information in the room for folks that have been doing this for a long time. Again, if you've got sort of a very specific question that's really about your specific client, I'm just going to reiterate, these are the folks to reach out to see if that's something that they might be able to offer some insight or guidance or assistance with. But yeah, just want to open it up to folks. If there's anything that's, just been on your mind, you're thinking about anything you kind of want to go back and review because you were like, oh, that was a lot. Can we review that particular piece? Because we've got some time here. So I'm just going to pause and see what bubbles up.
I have a favorite program. I don't know if anybody asked that, but I think Patty knows what my favorite program is. It is the MSP program. And I think for this presentation, it's really good to come away with some knowledge of that program because that's the program that has that overlap, right? Because it's for people on Medicare, so people who are on the federal Medicare program receiving that assistance, but it's a way for Washington State Medicaid program to pay for the federal Medicare premiums. So basically, Washington State Medicaid pays money to the federal government towards your Medicare premium. So I think that one is really cool how it connects and crosses between the federal government and the state government. So that one's my favorite.
Oh my God, I love that framing, Brittany, that you have a favorite program and why.
Yeah, I'm sure somebody was just about to ask what my favorite program is, so I thought I would throw that out.
I'm curious if other people have a favorite program, or Patty or April have particularly favorite programs or benefits that they want to share. I'm loving this framing.
I don't know if I'd call it my favorite, but I actually really do like the spend down program, specifically because instead of having that like hard cap of, you make more than $943 a month, you're just not eligible. It does create a system where if you phase out of that, you're not just out of luck. And it takes into account the fact that some people have really, really high medical costs and should be given this coverage, even if their income is also quote unquote high for the program. I understand that the way it's phrased and the way it's written out in the paperwork that goes out to clients is so confusing. And that's why I can't say it's my favorite, but I do really appreciate that it exists and happy to answer questions about it because there are a lot of questions that can bubble up.
Now I feel obligated to answer. Why is my camera so dark? I apologize. I'm like hidden in the shadows over here. I think the program that I work mostly with is the medically needy program, and that's because of how much I help with the like ABD applications and navigating the age blind and disabled program and like the link between those two. Um, so I think that like it's really more by proxy that that's the one that I tend to know more about and help navigate more.
Well, I appreciate all three of you sharing a little bit more insight into programs that you really have appreciation for or have a proximity or closeness to. And I think a lot of folks on the call know that my background is as a community health nurse, and I remember trying to understand these programs and the differences in the coverages and the spend downs and just being thoroughly confused regularly. And this was at a time when in community health clinics, if there was a social worker, it was really just dedicated for pregnant folk. And there, I think that has been a really beautiful thing that I have seen over the 2 decades of my nursing career, where I've seen much more of social workers being embedded into lots of different programs. And so I'm just gonna again reiterate just how knowledgeable and accessible the BLA team is to answer your questions. If there's even a little tiny part of you that's like, oh, they're lawyers or they're official and I can't talk to them. No, they're super lovely and accessible and wonderful. So Q, please take the floor.
Yeah, so I couldn't think of like a concise way to ask this question, but like fundamentally, us as like direct service providers, especially those of us who are just case managers, I'm not going to remember all of this. That's not going to happen. And mostly what I need to know is whether or not I should be pointing my client towards seeking legal advice, or whether that would not really be helpful for them. Because oftentimes I'll have clients that are like, I need a lawyer. And I'm like, no, you can't, they're not going to help you. So it would be good to know if you guys have any like hard and fast, like maybe red flags that a client could say to me about their situation that would indicate to me that like, oh, you could probably be helped by talking to a lawyer about this.
That's a great question. I don't think we have something so concise, but I will say, especially if a client gets like a denial letter, they're told that their benefits are going to be shut off, that they're ineligible, or they get a letter and they're looking at it and something doesn't look right. So if they're looking at it and they're thinking, that's not my income, or, that's not the number of dependents, something is actually wrong. We're happy to help. That's some very big red flags. That being said, if you're looking at it, clients saying, I need a lawyer, you're saying, I don't know, do you? Utilize our Ask a Lawyer program. You can put in some details and just say, is this something you help with? Is this something I should be sending your way? And we can let you know without them having to go through the entire intake process, just for us to look at it and go, oh, we can't help you. In addition, if you contact us through the Ask a Lawyer and we're looking at it and we're going, oh, this is really an SSI question, or this is really a housing law question, we're connected with a lot of other legal aid programs in the community that we can refer you to. Sometimes like very one-on-one, we'll literally call them up and say, I have a client that needs your help. Can you help them today? And kind of expedite that in a way that wouldn't necessarily be possible through other means. So I can't give you like a here's one to refer, here not, but utilize the Ask a Lawyer. I promise if you send us a dozen of them, we'll respond. As some answers might be more helpful than others, but we're happy to look it over and let you know if we agree that, yeah, this should go in front of a lawyer, or hey, this is actually an alternative resource you should be utilizing.
Awesome. Thank you.
Yeah, Q, thank you for that question. I think it was a really great question and really appreciate that answer, Patty. And I'm wondering if one of you might be able to put that slide up about Ask a Lawyer again, just if people are like, ooh.
I did put the
Oh, thank you.
text from it into the chat. So if you're just wondering, yeah, sure, that program, whatever it was, it's in the chat. You just email us benefitslegalhelp@solid-ground.org and just put in the title line, Ask a Lawyer, so that we know it's a question from a community provider and not a not a application. Yeah, please utilize it. Please share it with other people working hands-on with clients. We're happy to help the community and answer. Also, in addition, we are only able to assist people in King County. That's what our that's what our funding regulates. But if you work in other counties as well, and you just have a general question, you can use Ask a Lawyer for that as well. So if you're just wondering, hey, does this look right? Should I be referring them or should they ask for a hearing? We're happy to look at it, let you know our general opinion, even if we then can't help the client, so you know how to direct the client forward on their own.
Thank you. Really, really helpful. And also just really appreciate that it's a way for very busy case managers and the folks they're working with that have a lot of really competing priorities around, you know, probably some real basic and or survival needs, to get a relatively quick answer without kind of going through the whole process to then just be told like, oh, we can't really help you. So I really appreciate that point and that being a resource that you all are able to offer. So thank you. Just gonna open it up again for anybody that's on the edge of a question or typing.
Also, we may want to stop the recording and let people ask questions then. So if you have a question and you just don't want it to live forever on YouTube, you can ask it. We're happy to answer it as well.
Brilliant suggestion, Patty. Thank you so much for saying it. So yeah, I'm gonna officially thank Brittany, Patty, April for being here and sharing all their really great information in this training for Medicare and Medicaid. And I appreciate you all being here.